So, good day everyone. I am here to discuss about the health center in every rural places in Antiquera. So, health center are those community-based or patient-directed organizations that deliver comprehensive treatment and services in any individuals. So, most especially in rural areas. Rural areas are those places that has low population density and small settlements, especially in those places called Tabuan and Gansibuan, which are parts of Antiquera. So, there are some places in Antiquera that are considered as rural places because of not having those things that are needed, especially parang mga health center or even clinic. So, the purpose of the study is that this research is to aware the higher ups or the government that there are certain problems that are need to be addressed, especially these kind of problems, so that people of those places will feel at ease for their problem got solved and for their lives to go easier and to cure their illness as soon as possible.
Some of the barangays of Antiquera needs its own health center or a simple clinic. The reason behind our study is people have been saying that traveling from their place to the town takes a lot of time and getting and having the first aid or the immediate treatment that the individual needed. Another reason is that mortality rates from minor to major diseases are higher in rural areas.
As the conclusion, I say that having a healthcare or health center in every rural places or area here in Antiquera or at the other places is really necessary and needed because it could help individuals a lot to nurture their life and keep themselves healthy as they live their life. Therefore, it could help our community lessen the number of deaths and especially the risk of disease and allowing people to still live and make their lives go longer. Having this would lessen the people going in just one facility that is causing the place's chaos and the workers being pressured. It's very important to have a healthcare center here in Antiquera for our safetyness and have a free medical treatment for those people who cannot afford a medication from hospitals.
So here are the objectives of this research. First is to attain an established healthy community, promotes the importance of health, disease prevention and management, improve the health, well-being of local residents, and lastly, avoid the rising of death rates in rural areas. That is the most important objectives of this research.
Research question and hypothesis. Why do we need to have health center in every rural areas places? Number 2. What are the benefits in having a healthcare or health center in rural places? Number 3. What are the importance in maintaining individual health? Number 4. What action can we do in order to have health facilities in those places? Number 5. Why do we need to have to create a health center at those areas if we could just let them go to the town just like what the other people does?
In doing and conducting research, I will allow myself to talk to the people that are in charge to implement or conduct something for the community, which are the government or higher ups. I would also gather the data about having this kind of project facility.
We can provide important and relevant information about the kind of disease and risk factor easily if we already have the health facilities, because it would be easy for the facilitator to talk to them because they are already near to each other.
In attaining one's health, especially in rural places, is really important. That's why in this project I would be analyzing and collect data for the future patients. Also, set goals and commit to the ongoing or coming evaluations. If I also want it to be successful, I would be happy to connect and collaborate to the other organizations that would help me engage and improve this plan that I would be conducting.